Yeah, hi, this is Damian Campbell from HGH Vallarta Clinic, working with clients for HGH for about 10 years. We also offer stem cells. We're located here in Puerto Vallarta. We do have people in Cancun, Cabo, Tijuana, and Mexico City that work with us that can get you guys what you need.
Yeah, hey, my name's Leon here at HGH Vallarta. We'll be reacting to some videos today. Let's have some fun.
The exercise that can boost human growth hormone by 771%.
Wow.
Any ideas? Sprinting. We're only talking 20 to 30 seconds. And then you want to rest for 90 seconds, okay? And then you want to repeat this and work up to about 8 times. I'm going to put a study down below. You can check out the link. So sprinting can be twice as effective as injecting human growth hormone.
Well, that's great. I mean, sure. But I mean, there's not a lot of 50-year-olds sprinting. In fact, I read something. I was watching something, and it was like, after the age of 30, basically, not many people are be sprinting again in the rest of their lives.
It's a huge bother to people's joints. I mean,
yeah.
it's a very common issue for especially people who are a little bit older who might be interested in like HRT to have problems in like their ankles or knees.
Well, the thing is, so I'm watching this, and it's saying it boosts your HGH by 771%. Most of the clients that we've seen, and we do blood tests for everybody, their IGF is, I don't know, between 120 and 180, which are decent levels. And he's saying by sprinting, your just average person is going to boost it 771%. Those numbers don't even add up.
No.
Because I've never seen anybody with the IGF-1 levels of over 1,000. So,
the exercise that can boost human growth hormone by 771%.
Holy crikles!
Yeah, exactly.
Sprinting.
Well, I think he's talking about getting taller. So, but still, I mean, 700%.
I've never seen any kids with growth hormone levels at that level. I mean, listen, all the kids that we treat have IGF-1 levels that are normal because they're treating short stature, so they're normal. So they're for their age, they're normal levels. And we otherwise the endocrinologist would tell the kids to go, hey, just go sprint. You're going to grow taller.
The endocrinologist would be out of a job. Yeah, I don't know. I mean, right there, you just suggested that taking HGH will increase your IGF-1 by 350%, which is
771% anyway, so that's not true.
I mean, he said this sprinting would be twice as effective as taking HGH, which means by that logic, we can assume that he's talking that 350% increase at least would come from taking HGH in his experience, right? Which is obviously
I don't know who this
guarantee.
guy is or what he's talking about. I don't think he knows what he's talking about. Let's go to the next one.
Yeah, evidently not.
BS. All right, the title of this video is Dr. Pradip Talks About Growth Hormone. Let's do it.
Growth hormone. Now, why would I want growth hormone? Because growth hormone is the hormone that keeps you young. It's the growth hormone that makes your skin better, that replaces the dead parts better, and your muscles grow. So you do 10 reps, you're gonna put on more muscle than if your growth hormone is low. Growth hormone is low, you could be pumping iron all day long and you'll just get achy muscles. But you will not grow muscles. To grow muscles, you need growth hormone. Do you know how much growth hormone costs? A small 0.1 injection is about $400. 0.1.
Yeah, so he's right. I've seen this video before, and this guy's right on them. It helps you metabolize your protein better and metabolize everything better, and you get results with growth hormone. It works.
No lies there.
It's $400.
No.
It's so expensive, right? But did you know that if you fast, just a 2-day fast produced a 2,000% increase in your growth hormone production in a man?
Okay. I think that's been debunked, by the way.
When they talk about 2,000% increases, that means if your level's at 100, if your IGF-1 level's at 100, that means it's going to go up to what, 2,000?
Yeah, I believe so.
Or 20,000.
Long story short, it would mean your liver would explode.
Well, he's from India. We get a lot of counterfeit guys trying to sell us counterfeit stuff through Facebook from India.
Facebook and
But he's right. It does help. I think fasting does help to some degree, and I think obviously taking it brings it up, but
Definitely not 2,000%.
it's not going to bring anything. Nothing's going to increase 2,000%.
I think.
Where do they get these
really,
numbers
this
from?
is for. I think this is a tactic for views.
Yeah.
Well, I mean, if you're lifting weights all day and not resting, I mean, you're never giving a chance to your muscles to rebuild and get bigger. I mean, right? So if you're pumping iron all day, obviously your muscles are.
Yeah, but if your
ache.
hormone levels are low, you're going to have a hard time recovering, and you'll be energized and feeling better for the next day, and it helps with a lot of things. So this is okay. So this guy is on point
First half
with
of the
that,
video
but
is
I don't think anything's going to increase. Even injecting, it's even going to increase it 2,000%. It doesn't happen.
No.
You don't need to. What you're trying to do is you want to bring your IGF-1 levels up to the upper end of your natural range. That's it, and that's where you're healthy, and you want to keep it there. And then that's when you're going to get results, and you just maintain that level.
And it usually looks like a gradual, healthy increase. We're not, this isn't a night and day difference where just, on the second day of starting, you're already like up 200 points or whatever.
Right, and so the idea is to get your IGF-1 checked before you start, and then get it checked 3 or 4 months down the road to see where you're at, and then you can dial in your dosage, because you don't want to be over and you don't want to be low as far as your IGF-1 number. You want to be at the upper end of your natural range, period.
That's how we do it safe.
Yep. Are steroids in sports okay? This is the next one.
I don't mind that people use roids. I think they should use roids because they're using themselves as guinea pigs, and it'll all trickle down to us one day. And after they messed up, their heads get all big. I'm saying by the time we're 80, they're going to have like a steroid vaporizer that you can just inhale, and you're going to have abs. I'll get a full head of hair. You're going to be banging some hot 65-year-old. And it's all going to be because of these athletes and the sacrifices that they make that no one appreciates. Those guys in the 70s, the stuff they took in the 70s.
Oh, in the 70s, the steroids were crazy.
It was like horse tranquilizers. You came out with like a mane, just slapping children around.
They didn't have a mane. No one had a mane.
Some people would argue that.
So it's good for the sport.
I love it.
Bill Burr is so funny.
He's funny.
He's a great
Yeah,
comedian.
people use roids. But with growth hormone, with the thing with taking too much growth hormone, it's already been well known, documented for many years, is it causes organs to grow. So your heart's going to grow, your lungs are going to grow, your ears will grow, your muscles will grow. Things are going to grow. And then I guess your head, you can retain too much water. This is why you need to get your blood work done and check to make sure that you're not doing too much, because when you do too much, things are going to grow, and you don't want that. You just want to recover, you want things to rebuild and recover when they get, from working out, when you're breaking down, and your skin to get stronger, help with your sleep, et cetera. But taking excessive amounts is going to lead to side effects like organ growth, which is not good, period.
Yeah, obviously. Too much of anything is never healthy. So
Yeah.
thanks so much to these guys in the 70s, these athletes in the 70s, sacrificing, making the sacrifice.
Athletes now. Not just athletes, YouTube stars. So, dying from
heart attacks and
ever too much
liver failure. Jeez,
ridiculous.
That's rough. This took a dark turn.
Okay.
Palumboism.
Yeah.
HGH gut.
HGH gut. This one's on HGH gut. This is when your stomach gets swollen up from taking too much HGH, which is organ growth, because your intestines grow. Oh my Lord.
Yeesh.
What you guys are seeing here now is the abuse of insulin and HGH. You see that?
That guy's
HGH
pregnant with a
does
muscle
not
baby.
only build muscle cells and causes doubling of fibers, but it also grows intestinal organs and every other tissue. That's why this Mama Luke looks like he's pregnant with 6 babies in his belly.
Mama Luke.
Interesting choice of words there.
Okay, so there you go. HGH gut, perfect example of what happens when you abuse it. It's pretty easy not to abuse when you get blood work done and you're just trying to use it for anti-aging purposes. These guys are abusing it for bodybuilding purposes.
I wonder if he has any idea of what his insulin and HGH levels look like.
These idiots are using 10 IUs, 12 IUs, 15, 16 I, 20 I. Piana was using 20 IUs a day, and his heart exploded while his wife was giving him a haircut. And so he's dead. And so these guys, really, their lifespans are reduced significantly from being egomaniacs going out. I don't understand what drives them, but
Yeah,
Well, it's obscene.
yeah, their minds are a
Yeah,
little bit of
we're
an
talking
enigma.
about doing I do 2 IUs a day. And Piana was doing it for 20 years. He was doing 2 IUs every 2 hours when he was awake. I don't think he did it for 20 years, but he did it for many years. 20 IUs. And it's just like, the guy was, and
It's
then he was
insane.
there's
there's only one place you'll end up.
It's just,
and that's 6 feet.
It's just dead. Yeah, young, an early death. Anyway, it's sad. But anyway, don't do it.
He was pretty big. And the guy was like absolutely huge,
He looked big. He was enormous.
but he wasn't like ripped. He was huge. He was just his muscles were, everything was exploding. That's all.
His eyes were popping out of
He
his
is the
head.
human explosion.
Okay, okay, now we're switching to stem cells. So this is on Mr. Olympia gets stem cells in Mexico. So is this C-Bum? C-Bum got stem cells in Mexico. Yeah, so we're offering stem cells now too. Everybody that gets stem cells with us gets, all the stem cells are certified with a certificate from the lab with your name on it. It's like a prescription. So it's basically authenticity. There's a lot of scams. There's a lot of scammers in Mexico when it comes to stem cells. But anyway, stem cells do help. These guys are using it to recuperate, to, basically recuperate from injuring themselves. And, it works. So this is the deal. Stem cells are working. They're becoming more popular now, and people are using them to treat Alzheimer's and Parkinson's, and
Injuries.
cancer, injuries, anti-aging protocols.
Yeah, it does have a lot of uses.
Yeah,
a lot of uses.
it's just to feel better. People are getting pee shots in their dick for stem cells. It's true. It's funny, but it's not funny.
Yeah.
This stuff works because it increases, it reduces inflammation.
Some people ask, like, how do the stem cells know where to go first? And what our doctor has told us is that typically the process is you get like about 100 million in IV, so that those stem cells first go to where the body needs them to go because they follow signals in your body. And then if you're going to get them locally, after doing the IV, you get them locally, right?
Yeah, so it's like an SOS sign. So if you see, the thing is like we've had a number of clients come in and they're like they want to get it for a shoulder because they have an injured tendon or there's a problem. And so when it comes to, like, say they want a 50 million in their shoulder. And so what the issue is when they hit the shoulder with 50 million, and what happens if you have something an issue with your kidney, or there's another part of your body that also needs attention. So the way the stem cells work is they go to the areas that need the most attention. And so what the doctor says is the best way to do that is the client first gets 100 million stem cells or whatever.
Which I think is what he's doing in the in one of the pictures there.
What C-Bum's done here is I'm sure because the number of stem cells that people get is based on their weight. He's a big guy, so I'm sure he got 300. It's a certain number. I forget it's like 3,000 per kilogram or something like that, a max. And so there's a maximum of 300 million. I'm sure he got 300 million stem cell IV, and then he had specific injections into where he is the areas that were bothering him. I know he's had some problem with his knees, so I'm sure his both knees got hit. I'm sure all his joints got hit, and so.
Rotator cuff is another very common one that people come in.
Rotator cuff,
trying to fix that. Recover that. It's not like, you just want to kind of feel better, take a little bit of the pain away, make it recover a bit, and then it's not like a one-stop shop. This is something that it's this recurring kind of treatment you should do like once a year, every 6 months if you want.
Exactly. So a lot of times, it's basically an ongoing thing. It's not typically a one and done. It's like, this is what I want to do. I want to feel better. I'm not getting younger. I want to keep at my same level, or feel, have these injuries completely, at least feel as good as you can. It does help with inflammation a lot, and it does repair things. So
it's an alternative to surgery, which is,
it can be depending on what stage you are, the injury. Like it's like stage 1, 2, 3, and 4. Once you get to stage 3, it's like, surgery is probably the only way, but it's close. And definitely stage 4, but stage 1 and 2, that's the best spot to hit this. you know. And so you get an MRI, you figure out where you're at and really what you're looking at and what needs to be treated, and then you can go from there. Now, the anti-aging protocol is just kind of like, it's going to help just with things, you know, heal things up. And so that's the way it works. Yeah, C-Bomb. Yeah.
Yeah, he's great. Super great guy, you know.
Diego likes him a lot.
One of the GOATs for sure.
This is Damian Campbell from HGH Vallarta Clinic. While I am not a medical doctor, we do work with an endocrinologist and stem cell doctors who are experts, and we're just trying to relay information to you.
Hey everybody, well, this was Leon from HGH Vallarta. Don't forget to please like, subscribe, comment, turn on that notification bell so that you don't miss out on any of our content. And yeah, until next time.